Tonight, I want to talk about breast reduction, but specifically, how small can you be when you undergo a breast reduction?
Behind the mask. The more you know, the better you look. Behind the mask.
If someone says to me that they're a G or an H and they say, I want to be a B cup, probably cannot get you down to a B cup. But what I can do is make your breast as small as I possibly can. That doesn't mean you're not going to have a significant change to the volume of your breast. We do make significant changes and sometimes remove tissue in up to 2 kilograms per breast, which is like 5 pounds almost in weight removal. So there can be still very dramatic changes and a lot of volume removed for those patients that want to try to get as small as they can. But there's a couple limiting factors. When we do a breast reduction, we are cutting around the tissue in order to be able to move the nipple and the areola to a higher position. And we also have to preserve the blood supply to that nipple and the areola. So there's the nipple and there's the areola. And this is what we call the breast pedicle. Traditionally, for patients undergoing a large volume reduction with a very large breast, we're trying to make the breast as small as we can. We use what we call an inferior base pedicle, just meaning that your main blood supply is coming from the lower part, or really what we call the septum of the breast. And so those blood vessels are within that pedicle, and we have to make the pedicle sufficiently wide enough, usually 10 centimeters wide, in order to capture those blood vessels. If we're trying to be too zealous and make the breast as small as we can, and we use a very small pedicle, then what can happen is we miss those blood vessels that are going to the nipple and the areola, and the nipple and the areola would die. So there is a minimum requirement for the width of the pedicle in order to ensure that we capture those blood vessels so we keep the nipple and the areola alive. The interesting thing is with the width of the pedicle, so we need to make it wide enough to capture the blood supply, but everybody's pedicle is a little bit different. And some pedicles naturally have more breast tissue. You have to remember that everybody's breast is different, and breast is made up of breast tissue and fat, and it's a different ratio in different patients. So if you imagine that this is the breast, we can then go and remove tissue from the medial side, the middle part. We can remove, and I really like to try to kind of remove a lot of tissue in the outside of the breast, because patients with undergoing breast reductions typically have wide breasts, and they can be very heavy on this outside part, and that can be very irritating and annoying to where the arm is, because the breast is actually spilling over. On the inside, the medial aspect of the breast, I can't remove as much tissue from that area because we have to preserve a little bit more of that tissue in order to maintain the shape of the breast, and particularly the cleavage in the inside of the breast. I will also remove tissue from the upper part of the breast, and when we elevate the nipple and the areola to a higher location, and we're moving this pedicle and moving the nipple and the areola up, then some of this pedicle can fill in that upper pole and still give you good fullness. So that's one reason why there are some limitations as to how small we can go, simply because we have to preserve the blood supply to the nipple and the areola. The second reason is with a wide breast, we have to leave some volume there in order to be able to reshape the breast to get the very best shape possible. Because while this operation is focused on making your breast smaller and relieving the neck pain, the shoulder grooving, the back pain, lifting the breast off of the abdomen up to a higher place so that you get a much more comfortable, this is a functional operation. You're going to get the benefit of having a lighter breast, but it's going to be in a better position. But we also don't want to disregard how your breasts look. We want you to end up with the prettiest shape that we can do. And in order to do that, in order to reshape the breast, we have to have some volume there in order to be able to reshape the skin and over that breast mound to give you the very best shape. If we were to go in and just be very aggressive and just remove every single bit of tissue that we could, make the pedicle as small as we could to preserve the blood supply, you would end up with a rather empty, flat, hollow breast that doesn't have a good shape. So we also have to preserve some volume to the breast in order to get the very best shape for you. Remember, a breast reduction includes a breast lift. It's not really a lift and a reduction. It's just a breast reduction, which includes that lift. I did post my comment on Reddit. They banned me actually from the community on breast reduction because I said essentially what I just said here to you, and they said, well, that's misinformation because you can do and what they call an FNG, which is a free nipple graft. And that is true. That's a fair statement to make, although a free nipple graft the nipple in the areola does not look good when you use a free nipple graft. So as plastic surgeons, we do perform free nipple grafts, but we usually only do it as a last resort if the distance from the sternal notch to the breast is very long. For patients that have breasts that are almost going down, beyond their belly button. In that case, we can be worried that the blood supply of the pedicle is not going to be sufficient with that long distance to keep the nipple in the areola alive, and so we might detach the nipple and then put it on as a free nipple graft, which is really just like a skin graft. So it technically can be done. I have done it before. The problem is the free nipple graft does not look good. The blood supply to the nipple and the areola is much better when you can keep the nipple and the areola attached to the pedicle. And if you separate them and use the nipple and the areola just as a graft, as a free nipple graft, the blood supply is not as good. It has to get new blood supply from the underneath skin. And what happens is the nipple becomes very effaced. It becomes very flat. And the pigment of the areola changes. And you also get quite a bit of irregularity of the border of the areola. So it's really not something that I really ever plan on doing, and I don't think it gives you a very good result. So while technically you could say, okay, yes, I'm going to make the breast just as small as I possibly can and just take the nipple off and just put it on, the results are really not very good. So whenever we plan on doing a breast reduction, a free nipple graft is there if we need it as an emergency, but we don't typically do that because the results are not very good at all in terms of how the breast looks or how the nipple and the areola look after surgery.